And I would like to just give you a little bit of warning that some of the content in here might be distressing for some of you. So I will loop back and might be worth screenshotting the details here if you feel distressed at all by any of the content that we're covering this evening. So as you saw on the flyer, some of the objectives from this session are understanding informed consent. A lot of women don't know that they can even say no, but also that the act of just saying yes isn't necessarily proper informed consent either. We want women to really understand birth trauma and not placing the responsibility on you to reduce it, but how we can reduce it within the system, and really understanding the gendered-based violence that's occurring in the maternity setting. So I want to give you some context of what's actually happening within Australia and what Australian women are saying. We don't survey women in Australia well at all. And you might notice that if you've had a baby, you weren't actually asked about your experience. You might have been asked, were the toilets clean, or something, or you know, if you were lucky, you might have been asked if the toilets were clean, how was your food? But very rarely do we actually ask about how you were treated, how you felt about your experience. But there have been some surveys outside of hospitals that have captured some really interesting data. So back in 2010, we actually had a Queensland Centre for Mothers and Babies. They released a Having a Baby in Queensland survey. From memory, there was over 3,000 women that answered those questions. Not every hospital actually handed those to women. So it was interesting, the data that was captured or not captured. I have no idea why a hospital wouldn't want that feedback, but there you go. 52% of women had said in that survey 12 years ago that for planned caesareans, they had not fully consented to the procedure. When we look at epidurals, 30% of women were not fully informed or consented, and episiotomy rate was 26% of women were not informed or consented. I have no doubt that this would be a huge issue now with the prenatal tear bundle, and that 1 in 4 women that are birthing for the first time are ending up with an episiotomy. No doubt that that information there probably would be significantly more now. Maternal Health Matters is an organisation that's not dissimilar to Maternity Consumer Network, and they had sent out a survey 2 years ago and found 20% of women said that they'd received disrespectful treatment. I actually thought that it would be a lot higher than that, given what I hear from women. 20% of women thought that birth negatively affected their relationship with their baby, and 30% had an experience that felt that they had a negative experience about themselves, but that rose to 50% for those who had caesareans or instrumental births. Again, we are not collecting good data, so a lot of this is coming from researchers asking women questions, and Rachel Reed was one of the researchers in the 2017 study that asked women to describe their experience of birth trauma. More than 700 Australian women answered that. That was a global one. Some of the themes that were coming through were prioritising that care provider's agenda, disregarding embodied knowledge, so the woman's embodied knowledge that was disregarded, the lies and the threats from care providers, and violation. In that study, it was recognised, and this is what we've seen in other studies as well, smaller scale studies, that about 1/3 of women are experiencing birth trauma. This was a really interesting study because in this study, it looked at not just birth as being traumatic, because often birth is framed as being a traumatic event, but what was traumatic was the way women were being treated, and 66.7% of women described the care provider interactions and the mistreatment, which was the traumatic part of birth. Some of you might be aware of the birth experience study, so it's still under review, but 8,800 women responded to that. That was asking women who'd birthed in the last 5 years about their experience. It identified 29% birth trauma rates, but induction of labour had the highest birth trauma rates, not just around the lack of consent, but a lot of women, when asked to comment about it, were bringing up the issue of vaginal exams. 12% of women actually identified obstetric violence as an issue in that survey. And when I had asked the researchers, how did you define obstetric violence? I said, without a doubt, women know what obstetric violence is. They were asked about, did they think that they received dehumanising treatment of the body or reproductive processes? And from the comments, and I'm not a researcher, but just talking to the researchers, that is a lot of comments in the feedback around the birth trauma rates, 626 comments on trauma and obstetric violence, and the common themes were dehumanised, violated and powerless. Because we don't collect good data in Australia, we've had to look overseas to look at, does the mistreatment vary in differing cohorts? And absolutely. Giving a Voice to Mothers study, and it used the Madam and the Maury, so Mothers on Respect Index and the Mothers' Autonomy and Decision Making, those two surveys, and it found that women of colour reported significantly higher rates of mistreatment. So Indigenous women, and obviously this is in America, but they were the most likely to report mistreatment, 33%, followed by Hispanic women at 25% and Black women at 23%. White women were the least likely to report mistreatment. So if we look at the history of how we came about to develop the Respectful Maternity Care Charter, and I guess how this was highlighted as an issue. So back in 2010, we had this landscape report by Bowser and Hill exploring that evidence of disrespect and abuse in facility-based childbirth. So they were collecting evidence. From that came 7 main classifications, which are down the left-hand column. So, and for those online, you'll see, if you scroll down the page, you'll see them under headings. So the physical abuse, and a lot of people think, oh, it's maternity care, how would I receive physical abuse? But it's things like being held down, forced into vaginal exams. We've got non-consented care, and to me, often they will overlap as well. This one, the non-consented care, is where we're looking at informed consent and refusal. Care providers respecting what your choices are. And particularly during COVID, looking at a companion during maternity care, because one of the first things to go, unfortunately, in maternity care for women was having adequate birth support of their choice. 3 was non-confidential care. 4 was non-dignified care, including verbal abuse, which unfortunately, like when I interview women, I hear that as well, like women being disregarded or called names during birth. Discrimination based on specific attributes, which we've seen when we looked at the data just before around varying cohorts, reporting more disrespect than others, abandonment or denial of care. And people would think in a wealthy nation such as Australia, how does that happen? But what I see is particularly something like around women wanting a vaginal birth after caesarean, or women wanting to access a water birth, or they've got gestational diabetes and all of a sudden they've got to jump through hoops. So I know, even in Australia, there seems to be a push from the medical establishments that this is for developing nations. It's not actually the case, because all of these things happen in wealthy places in Australia that are well resourced as well, and detention in facilities, which has happened to women in this country as well, where you're detained for not complying with what the hospital wants. If we jump then to 2011, White Ribbon Alliance. So you might be aware of White Ribbon Alliance and their campaigns often around gender-based violence. They have picked up that maternity care is an issue. And they published the Respectful Maternity Care Charter, the Universal Rights of Childbearing Women, and it utilised that report from Bowser and Hill in 2010, and they've since, through, with various organisation consultation, they have not redeveloped it, but they've continued to add to it and improve that Respectful Maternity Care Charter. But it's just because it's your right doesn't mean that it happens, unfortunately, but it's really important that as women that you understand what your rights are. From 2011, 2015, the World Health Organization issued a statement condemning the abuse of women in childbirth. And you can see from here, again, informed consent, it's these repetitive themes that have occurred over and over and over again in all this data that's been collected, except for often the places that you're birthing aren't collecting the data well. And the UN report, which we were involved in making a submission, also looked at the issues of widespread violence against women in birth. And somewhere around then was when the term, it had been used before, but where it became, I guess, more solidified as a term to identify the gender-based violence that occurs in the maternity setting. In 2019, so back to, I guess, Australian context, the National Strategic Approach for Australian Maternity Services was published, and I was involved with that consultation, and as were many women who travelled, sometimes great distances to be heard. One of the themes was around, having, and we've got it as number 2, respectful care, because women were saying that their choices are often nullified, that they weren't being heard, that they weren't consenting to procedures, or they might have been giving consent, but it was under coercion, so it was more compliance than consent. And ideally, this is what we want our maternity care to be like, to be woman-centred and individualised, and all these things that this wheel is identifying. So part of this around respect is why we're doing what we're doing as well. So educating clinicians, but also, I guess, informing you so you know what your rights are, your job, and when they're being violated. So obstetric violence, it is a term that started overseas in basically Latin America. And the reason they use the term obstetric is not because of obstetrician, it's the facility in which we're birthing. Often too over there, midwives don't lead care, it's often obstetric care. So whilst I know that obstetricians are a little bit woe is me when using obstetric violence, it's not actually about them. It's about having a term also that women can use to describe their mistreatment as well. And when we talk about violence, it doesn't always mean physical violence either. It's all the things that we're talking about as we're going along, and that respectful maternity care charter. Like if you're not getting what's in that respectful maternity care charter, that is obstetric violence. So I found this and I thought it was a really good way to, I guess, break it down, but particularly these umbrella terms that often women mightn't identify. Like they know that they've been mistreated, but they don't necessarily know what the name is for it. And again, lack of informed choice and consent, policy and routine over evidence-based practice. And that's another thing continually hear from women. This is the policy, this is how it goes, this is our guidelines, or whatever other things. This is just what we do in this hospital. So in the Bowser and Hill report, which was basically the foundation one that started to go, hang on a minute, we've got all these stories, and that's when they identified those 7 categories of mistreatment. But they also looked at what was, what would you say, what was influencing that mistreatment, and from the provider's attitude and lack of training, which is where we're trying to address. The lack of standard leadership, lack of human rights in national policy, but I actually think that there is international laws around this, but when it's at a hospital level, we seem to ignore the human rights. And I think as women, this is where we can come into and be reminding the hospital system, like, that's not in line with human rights. And I've had actually calls that I've called health services that have detained women, or what else have they done? Like, if we talked about that denial of rights and reducing women's freedom, like when I've called up the hospital about those kind of things, the first thing I've said is, do you know that this is in breach of human rights? And it actually transforms the whole conversation. So whilst it might not be your whole responsibility to change the system, at least if you know about it, you can be raising that if you're coming up against these things. But one of the biggest things I think is between that care provider and lack of education is also the normalisation, disrespect of abuse during childbirth. And this doesn't exist within a vacuum. We look at the violence against women in society, and the people that work within these institutions aren't immune from that. So we can't think all of a sudden that when we've got a society that devalues women and is so disrespectful and violent towards women, that somehow we're going to magically walk through these hospital doors and we're going to be treated well. It just doesn't happen, unfortunately. I'm not saying I agree with it, but I'm just, from a consumer point of view, my observation is that we're not immune from the mistreatment just because we walk through those hospital doors. I want to go through the current decision-making tools that are used. You might have seen them, might not. Has anyone perhaps had that discussion with a care provider and used any of these tools? So for those online, I've got the BRAINS and the SBAR acronyms. So benefits, risks, alternatives, intuition, nothing, and space. And then what's the situation, background, assessment, and recommendations? Has anyone been faced with procedures or intervention and had that discussion? Oh, I've got a few nods. Awesome. So I find often women, this is not used as a tool. It's like often this is just what's happening. And losing that sense of autonomy and being infantised is a big part of where women will experience birth trauma. And we know that that was coming about through these surveys, and that almost 70% of women saying that it was that mistreatment and disrespectful care, because women often feel like their choices don't matter, that they're being infantised and told what to do. In the UK, what's being trialled is the I Decide, and for those online, I will switch my laptop around in a sec. So identify the urgencies, the detail, of the current situation, exchange objectives, making sure though that when we're looking at the choices available, so evidence-based, that it's also individualised, because what might be relevant for a young woman might not be the same for someone who's, carrying twins, or, whatever the situation. We have to move away from this standardised care. And again, you as women and service users, this is where, by knowing this, you can say, hang on a minute, are these risks that you're telling me, are they individualised to my situation? I, the woman, confirm my understanding and seek clarification. This is really hard for women. It really is. Very rarely is that power imbalance acknowledged in the system, that when you go in there, there is the expectation that your care provider is just going to do the right thing for you. And I'm not saying that they don't, but I'm just forewarning you that you may need to have those difficult discussions around, I don't understand what you're saying, or I don't believe that this is actually the right thing. And you might need to actually even seek information and research outside of what you're being told within the institutions. Making sure that you make the decision, but often what's never done with these other decision-making tools is evaluation, asking the women about their experience. Were you autonomous in your decision-making? Were you happy with it? What happened? Were you mistreated and things like that? This is what we're not capturing, which I think is essential to be able for care providers to reflect and improve their practice. Is anyone aware of, so this is for Queensland for those online, but I don't see why it couldn't be used in other states. It's a guideline, FYI, that doesn't mean that it's the law or it negates your right, but I know it's often used to impose certain things onto women. Has anyone heard of this tool, partnering with women who decline recommended maternity care? Have you used it? How did it go?
Me?
Yeah.
Superbly for me.
Yeah.
Not so well for the hospital. They weren't stoked.
Yeah.
But, I felt very empowered to walk into that meeting and appointment knowing my rights and knowing what I was asking.
Did they tell you about it though?
My care provider did.
Yeah, but not the hospital.
No.
So, and this is really important too, tell women about this stuff. This is not, there are actually forms that are flyers that should be for women displayed. but it's almost like they don't want you saying no. So just, this is available. I'll pull this from the guideline, basically because this came about back in, and you were there too, Barshi, about 2015. There were all these complaints to the Ombudsman from women because it's the same old stuff just over and over again about the disrespectful care. Basically, it was also on the back of that QMBC study in 2010 that there seems to be this invisible line in the sand that the clinician draws about what you should do and what they should do. They won't tell you what that line is, but if they perceive that you cross it, that's when the coercion and the bullying starts and often escalates to assault. So things just being done anyway. So part of what was from that statewide forum and that 2010 survey was developing these guidelines. So it's great because obviously the coercion and the bullying and the mistreatment of women has been acknowledged. But what I find, and I'm glad you had a good experience with it, Sally, but what I find is it's often weaponised against women. You want a VBAC, you go fill out this form. You know, it's not actually being used as intended, but it does maintain it. It's got some really good points throughout the document, like don't be coercing women. It's important to maintain that relationship. So she keeps coming back to, because we don't want to go into the system that's not going to treat us well. And so women will pull back from care. And again, this part of it is for clinicians and midwives. And again, some good things from it. I think one of the things is just that women need to know that they can decline the care, but you don't have to fill that in either. You have every right just to say no. It's very onerous, particularly like you're fairly well educated. You can imagine someone who's got low health literacy, a migrant woman, you know, or a woman who's just got multiple things going on does not want to be given 2 A4 pages to tell the clinician why. Why do I want to exercise my bodily autonomy? Like, it's totally bullshit. But it is there. So it's just have those discussions with people as well. Like, you know, women will often go to their peers because there has been so much general distrust in the system. We'll often look to peers before we'll look to care providers. So have those chats with women. Go, do you know that you can say no? There are declining recommended maternity care guidelines, but even just to have that discussion with the clinician, like I know I can say no, and you've got guidelines you're meant to be following. Does not mean that you have to fill out the 2 A4 pages, but yeah, it's a start. So when we look at birth satisfaction that we're not capturing, the two that I think that are really awesome that were also used in the BEST, so the birth experience study, the data that I brought up before, the 8,800 women had filled in, they're using the Mother's Autonomy and Decision-Making Scale and the Mothers on Respect Index. If you have a look in and I'll share the screen later for those online, or you can just Google it, but this is probably the best that I've seen surveys of women. Now, if you're a woman, have a look on the left-hand side, and if you're a care provider, I've actually tried to tweak this to make it a bit of a self-reflection tool for them. And interestingly, when we've surveyed women, like smaller scale anecdotal stuff, asking them about their experience, and when it was, when women have used this tool overseas, 95% of women said it was very important to lead decisions about their maternity care. And the ones who had low scores on this indicated inability to direct their care. So that lack of informed decision making. So, so for those online, I have actually pasted here. That's just the Maury though. So looking at respect. Is there anything that you think could or should be added to this? Okay.
Maybe some even breastfeeding decisions in the hospital.
Yeah, and that has been recognised under obstetric violence too, like babies being forced to the breast or babies being taken away or given formula without consent. Yeah, all comes under obstetric violence. But that's good to know because we can feed that back in. These are available online, but for research purposes, so I think you need permission. Obviously, I had some contacts. But that's actually a really good point because we have such low breastfeeding rates. And again, it's not a women's problem, it's a mistreatment and lack of support and education problem.
And the other thing I noticed that there was one of the big things that comes up is, and I don't know if it's their age and weight. Like.
Yeah, that's actually under the madam. So if you flip over...
I saw it in here, but I wasn't sure if that...
Yeah, that's the Maury. So yeah, they're two different surveys. One's on respect and one's on autonomy and decision making.
Yeah, so I think that would play into respect as well.
Yeah.
Obesity.
Yeah, I agree. Yeah, so maybe because they're used often concurrently, as far as overlaps go, but I often think that it's good to keep reflecting any feedback from these surveys because otherwise it's just that same old, we're doing the stuff and not asking women, was this survey suitable to capture what you wanted? You might need tissues, I don't know, but this is where it starts getting a little bit maybe confrontational for some people or emotional because this is where we start hearing about women's experiences. Again, it's not to scare you, but I was talking to Barshi about like what to include and what not. And I think I used to somewhat lull women into a false sense of security and be like, oh, you'll be right, it's not that bad. But we have to use the right words and capture women's experience. And I would think I'd be doing a disservice if I didn't tell these women's stories. So let's...
Being bullied into interventions with wording such as, do you want a dead baby?
Got it happening now.
I was bullied into an induction late on a Sunday night and then told I would be kept overnight. I wasn't aware when I finally agreed to be induced after quite some time of being threatened with dogs.
This isn't isolated either. This isn't like I've just captured the worst.
I was bullied into an induction late on a Sunday.
There we go. Maybe if I just do that to
My daughter was breech. I was told that if I didn't consent to the caesarean before labour started, then they would perform a caesarean without my consent under general anaesthesia when I arrived. I felt like I was being told I was silly for thinking I was in labour and that this awful pain was nothing to be worried about. My opinion was dismissed and ignored, as I was just a first-timer. Hospital staff did not listen to me, didn't trust me to know my body. Dismissed me as a first-time mother who was overreacting. In actual fact, I dilated from 0 to 6 in just over an hour. The hospital midwives told me that I was just feeling the period pain associated with early labour and induction. I had the strongest urge to push. The midwife on staff insisted on an internal examination to check dilation. She told me if I pushed now, I would end up with an emergency caesarean due to my cervix swelling. She then spent the next hour yelling at me not to push and trying to talk me into an epidural. I was trying my hardest to not push, but my body kept taking over. I was begging to be allowed to push. I was steamrolled with unnecessary intervention and didn't get to speak with a doctor about my options, risk versus benefits. I feel like the midwives, doctors and hospital only did what was in their best interest, not mine. It was a nightmare. I begged not to have a C-section. Neither I nor my baby were in distress or danger. But because the doctor was ready to go home, he did a terrible section that resulted in almost a year of recovery.
So I just quickly want to go through, and you've probably kind of guessed that by now, that evidence is a long way down the line of what informs your care options. Often I hear from women that guidelines and hospital policy take preference over what you want, which isn't right. But again, I'm just telling you about what the system's like. We obviously have personal bias, and I've been working on some guidelines lately with some doctors who've never seen physiological birth. And I thought, well, how are you ever going to support that if you've only ever seen surgery or inductions? Like, it becomes so normalised then. So everyone brings their own personal bias. And then, of course, we've got hospital culture, and we see any number of these or multiple of these influencing not just the mistreatment, but even if we look at the intervention rates that we see with the unwarranted variances. So a few years ago, there was like a 3-fold variance in the caesarean rate and an 11-fold variance in the rates of 3rd and 4th degree tear. Women aren't that different because it was the same cohorts of women. So we're looking at low risk women and the variables. So it's not that your bodies are flawed at all. It's the system and all these things that influence your care. Guidelines, I work on guidelines, and the theme with guidelines is midwives may, doctors do, or I should say midwives have to and the doctors may do. So they're still very authoritarian, not always the best evidence, because basically it's a panel of often doctors that are choosing where they're getting the evidence from. Some things haven't been shown to have good evidence and are still considered standard practice. So if we look at like continual fetal monitoring, which comes up time and time again as women not necessarily wanting it, but feeling like they're forced to accept it. This has not had good outcomes for a long time, yet it's still standard practice. Only a few months ago, I saw a hospital online boasting about this new continual fetal monitoring machine. So don't think that just because you're birthing in a hospital and we're a wealthy nation that what is offered to you is necessarily going to improve your outcomes or is evidence-based. Of course, none of this negates your right to saying no, but I'm not saying that's easy either. And Barsha will talk more about the coercion, things like that. Okay. This is Ellie. I'm going to share her story. This is what Barsha were having. This was actually excluded and then it's come back in. It is quite traumatic in patches. Some things will probably resonate with, many of you in this room, things that have happened and the mistreatment. But I want to show you, to give you an idea that this isn't happening to other women, it's happening to all of us, and the effects are long lasting as well.
I wasn't feeling any pressure, but I was definitely feeling every contraction. I was starting to get a little bit of movement back in my legs. They started being quite concerned about his heart rate. At that point, a doctor that I'd never met before in my life came in and wanted to prep me for a forceps delivery. And he was like, "Oh, look, we're not there yet, but I'd rather do the prep just in case." And in my head, I was like,
But can you explain what the prep for a forceps is? Like, how do you prep for that? Like,
no,
what did he?
No, I didn't ask that at the time, which I should have, because I would have realised that what that meant was what he meant was he wanted to give me anaesthetics basically, but I didn't know that at the time. I didn't know what he meant, and the anaesthetics didn't work on me, and I knew they wouldn't.
Yeah, so
but he didn't.
So he could cut you.
Yeah. Well. Yeah. But he didn't explain any of that. All the only explanation was I'd like to do the prep just in case, and I consented to that. I gave not informed consent because he didn't inform me of anything, but I gave free willing consent to that because in my head I was like, well, I don't see any harm in doing the prep, and I don't see any point wasting my energy arguing when it's just a prep. So that was fine. He did the prep, and then he left, and then they wanted me to start pushing. I wasn't feeling any urge to push. I really just wanted to be moving around, but they wanted me staying in the bed. And they didn't give me any, like no one asked me, are you okay with coach pushing? They just start saying, you need to push, you have to push, which I was very much didn't want any coach pushing. But at that point, after 3 days of no sleep and in that situation that I never expected myself to be in the hospital in the first place, I just did what I was told. Then they started telling me I was pushing wrong because I was breathing. They told me to hold my breath.
I mean, I've got it on mute, and you can imagine what I'm saying, even though I'm on mute, because this is like,
yeah.
But it dehumanises it, but also like, where the hell is the evidence behind this stuff?
Yeah,
so,
and they're saying we're concerned about your baby's oxygen levels, and they're telling me to hold my breath, and I'm like, hang on. but I didn't have that logic mind at the time. They're just saying you have to hold your breath. We're getting worried about the baby. Baby's got to come out. You've got to push. Don't breathe while you push.
Yeah, but it's not your fault. I mean, you did the best you could with what you had. Even though you know that like that holding your breath does not provide oxygen to baby. There's a huge power imbalance. We're in that fight, flight, freeze, so we can't even rationalise what's going on. So don't worry about having to explain yourself. It's their job and their total fuck up.
Yeah, absolutely. So they've got me pushing. I think initially they weren't seeing. They said I was using the right muscles, but they weren't seeing much progress. And then I was pushing on my side, and then they decided to get me on my back in stirrups, and get me to push in that position, and they could see. They just told me to do it. I think it was something along the lines of, "Hey, we want to try this. Roll over." So once I was in that position, apparently they were seeing a lot more progress, but no one was telling me anything. I was just they only spoke to me to tell me what to do. I found out that they were concerned that I had an anterior lip, not because anybody told me, but because I heard someone with their hand inside me telling somebody else in the room.
Was there any consent to give a vaginal exam?
So I gave consent to the exam. Then they were trying to push the lip back in, like manipulate the lip, which no one discussed anything with me, and I didn't get any opportunity to give consent to that. All I consented to was a check.
And even the check, like benefits, risks. I said the check.
Nothing of that. There was no. I don't think. So the whole time I was in hospital, there was only two times that I was informed of any risks of anything the whole time I was in hospital. The second one I'll get to, but the first one was before I got the epidural, that there's a slight risk of paralysis. That was the only risk of anything that I was told about at this point. I felt very much like I was just, like everyone was talking around me, no one was talking to me. They were all saying how they're all watching the monitor and saying, "Oh, we're worried about this, look at this drop, that drop." But the monitor's behind me and I can't see it. So I'm like trying to, like, still half paralyzed and trying to turn around to look at the monitor because no one's telling me anything. Anyway, so then the epidural basically wore completely off. I had pretty good movement of my legs. I could feel everything. They got the anaesthetist to come back and give me a third dose of the epidural, which I didn't know at the time, but I've since got my medical records, and that third dose was a different drug than I'd had the first two times, and it didn't do anything at all. From every contraction from then on out, I felt more strongly and had gained more movement. And then at some point, this doctor that wanted to come and prep me for the forceps. So then his heart rate, my baby's heart rate, he had two late D cells and late D cells and slow recoveries. So his heart rate dropped right down after or during the contraction, and then I had a slow recovery, and then became quite fast up, like in recovery after I recovered from that. So he had two of those big dips in a row, and then all these people burst in the room. This doctor that wanted to prep me for the forceps comes in and goes, "We have to do forceps, baby has to come out now." And I go, "No, we're not doing forceps."
Oh yeah.
And it was like he just didn't hear me. Like he just could not comprehend that I said no to that. And it was like he was like, "Oh no, but you don't understand. We have to." And I kept saying, "No, we're not doing forceps." And he just kept saying, "But we have to." There was no there was no discussion about, like, he told me why he wanted to do the forceps. He explained about what was happening with my baby's heart rate, which I understood, but I just didn't agree that forceps was the right thing at that point. I said, give me 5 minutes. And he said, "You don't have 5 minutes." And I said, I wanted to get up, because I regained feeling in my legs. I could move my legs independently. I was very confident that I could stand up, especially if supported or leaned against the bed or something. And they said I couldn't get up because I'd had an epidural. And I said, "But the epidural's not working," and they didn't believe me. And he just kept coming at me over and over and over again with, "We have to do forceps. We have to do it. Have to do it. Have to do it." And I kept saying no, and it was just like he just could not understand that word. Like I was speaking a different language. And at some point I said, asked me again if I consented to the forceps, and I said, well, you're telling me I have no choice. And I feel like that kind of took him by surprise a bit. And he went, oh, well, you always have a choice. And I said, well, what are my options then? And he said, oh, well, I can take you for a cesarean. But that's a bad idea because X, Y, Z. And so then I started to get quite worried because I kept saying no. I was very confident that I didn't need forceps, that I didn't want forceps. I understood what his concerns were, why he was concerned. I agreed that it was concerning and that something needed to change. But I was very confident that what needed to change was that I needed to get out of that bed because my body was absolutely fucking screaming at me to get out of this bed. I would have been perfectly happy to, I needed to be upright. I would have, in my head, that meant I have to get out of the bed to get up. I would have been perfectly happy if they'd said, hey, what about if we get you on all fours in the bed? Or kneeling in the bed, something like that. That would have been perfectly acceptable to me. But they just said, no, you can't get up. You had an epidural. You've got to lay flat on your back in stirrups. And yeah, I got to a point where I was like, he's not listening to me. He's not going to hear no. He's not going to accept that answer. The only answers he's going to accept are those two options he's given me is a cesarean or a forceps delivery. And neither of those are acceptable to me. Had no intention of consenting to either of those things. And I thought in my head, I was like, okay, they're not listening to me. I just have to get up. I have to stop worrying about what they say I can and can't do. I know I need to get up. I'm just going to get up. And I got my legs out of the stirrups, I swung them over to the left, and then all of these people rushed towards me and grabbed onto my legs and held me down in the bed and forced my legs back into the stirrups. And at that point, I got really, really scared because I realized that but I realized that I had no idea what these people might be capable of. If they were going to hold me down in the bed like that, if I kept refusing, I worried that they might strap me down to the bed and do the forceps anyway. I got worried that they might just take me off to surgery and knock me out and take my baby from me anyway. I got really scared because I never imagined that I'd be physically held down in the bed in a hospital. So I had no idea what they might do. Anyway, I kind of withdrew a bit at that point, trying to work out what to do. And he still kept coming at me saying, so do you consent to the forceps? Do you consent to the forceps? And I still kept saying no. And after a bit, he said, I decided that I would rather the forceps than a forced cesarean. So I said I consented because I was scared of what might happen if I kept denying what he wanted.
Yeah, and I think it's sexual assault, like just talking to trauma specialists, a lot of women just go, well, it's going to happen, so let's just get it over with.
Exactly. It's going to hurt more if I keep fighting it. That's exactly what I was thinking, what I was feeling. So then he left to go to, get what he needed. And when he came back, so with the discussion with the forceps, when he first said that he wanted to do forceps, there was absolutely no discussion at all about any risks whatsoever. There was no discussion about any alternatives, except when I outright said, well, what are my options? He didn't explain like what a forceps delivery would actually involve. The only explanation was forceps. So then he came back with the forceps, I presume, and then said, and I need to cut you as well. And I said, no, we're not doing that. And again, it was like he couldn't comprehend that someone might say no to him. He was like, but I have to. And then he decided to tell me that he had to cut me because the forceps put me at much greater risk of a severe tear. So why didn't he tell me that when he suggested the forceps? That only became relevant information when he could use that against me to get something else he wanted from me. Yeah. Anyway, then there was pardon?
So he ended up cutting you and using the forceps?
Yeah, so he said that about the episiotomy. I said I'd rather tear. There was a discussion about like that risk, about a 3rd or 4th degree tear. and I still said I'd rather tear, and the hospital midwife has noted that in my records that I still didn't consent. And yeah, he did it anyway. When he put the forceps, I don't know which side it was, but one of the forceps, when he put it in me, it felt like I was being like split in half. Like it was the most painful experience I've ever gone through in my life. I literally felt like I was being ripped in half. And just recently, I've had an internal exam from a physio, women's health physio, who said I've got scarring down that side, which I can't make any conclusive, can't make any solid conclusions from that. But I believe he injured, like cut me, tore me, grazed me, whatever, when he put it in. That was more painful than being cut, although I felt both. My partner said I absolutely just like screamed out in pain when he put them in and when he cut me. Because of course the prep that he'd done didn't work, which he would have known if he'd told me what it was. So then he did the forceps, he cut me, baby's head was out, and this woman in the room, there was about 10 or 15 people in the room at this point. I don't know who most of them were. They all just rushed in when he came in. But somebody in the room in the corner, I remember saying, Elian, touch your baby, reach down and touch your baby. And I reached down and put my hand on his head. Well, it was just his head born, and then the doctor pushed my hand away.
Sorry that happened. That's really terrible.
I just remember thinking, after everything that he'd taken from me, why that as well?
Yeah, I know it.
So then his shoulders were born, and as his shoulders were being born, I put my hands down again, and I put my hands around his shoulders and brought him up to my chest. And I just remember thinking, feeling relieved that it was over. I just remember like this, I wasn't happy to see my baby. I wasn't, excited to meet him, to look at him and think about how wonderful he was that he was there. I was just relieved that it was over and they were going to leave me alone now.
Yeah, it's like a sexual assault case, really, isn't it? Like that shut down, just get it over.
It feels like I was raped. It absolutely feels like I was raped, and if I could go back and change things, I would absolutely rather be raped at any other time than when I was giving birth. Because not only did I go through that horrible assault trauma, but I lost my baby's birth out of it as well.